Hello, welcome. Thank you for joining me today to talk about social welfare policies and services for children and families. My name is Shauna Lee, and I'm an associate professor at the University of Michigan School of Social Work. And today I'll be talking about policies and programs for children and families across 4 different eras of U.S. history, starting with the Progressive Era, the late 1800s to early 1900s, the New Deal era from 1933 to 1938, the Great Society, also known as the Civil Rights Era, and the War on Poverty era from 1963 to 1969. And then we'll talk about welfare reform and beyond, about 1996 to our current time period. And I'd like to note that I'll mostly be talking about policies and programs that relate to the health and well-being of children and families, noting that there are many other policies and programs that I don't have enough space and time to talk about today. I'm hitting some of the high notes. So first I'll talk about the emergence of the social work profession, which, although it took root and really gained much momentum during the Progressive Era, preceded the Progressive Era with particularly the formation of settlement houses. So in the mid-1860s, Toynbee Hall in England was the first settlement house. This approach of building houses in communities, low-income communities, and doing community organizing within those communities took root and influenced the thinking of many Progressive era social workers like Jane Addams, for example, who founded the settlement house in Chicago. So the social work profession really emerges and strengthens in the United States in 1890 and going forward, and then sets the stage for the significant reforms that take place during the Progressive era. So the Progressive era, many important reforms were made during the Progressive era, but I'll focus on some of the key reforms for child and maternal health. The U.S. Children's Bureau is one of those key reforms, which was established in 1912. The Children's Bureau established a service delivery system for children, youth, and families in the United States. It was really the first time in the history of the United States where the federal government took on and acknowledged that there is a key responsibility at the federal level for providing for the welfare of children in particular. One of the main activities of the Children's Bureau was to establish programs to monitor infant mortality, so to establish one of the key health indicators of child well-being, and also to provide birth registration programs and to provide parent education to new mothers about safe infant care. During the same time period in the Progressive era, the Association for Organizing Family Social Work was established in 1919, and the Child Welfare League of America was established in 1920. Again, these were key programs that established the social work profession and worked in parallel to the reforms that were taking place during the Progressive era. Notably, women achieved full suffrage voting rights in 1920 with the 19th Amendment, and many scholars have attributed the emerging focus on the health and well-being of children and mothers to the fact that women gained the right to vote and thus utilized their suffrage to promote programs that served women and children that previously had been largely ignored within the federal context. Following from that and voting rights for women in 1920 was the Shepherd-Towner Maternity and Infancy Act of 1921. This act represented the first federal effort to establish a maternal and child health infrastructure within the states. So it established the groundwork for collaborations between state and federal governments to continue the momentum of the Children's Bureau and to address maternal and child health from a much broader perspective at the state level. So both the Children's Bureau and the Shepherd-Towner Maternity and Infancy Act essentially were the first programs and policies that established maternal and child health as a federal priority and a federal responsibility. Next, let's talk about the New Deal era. The New Deal era was really a response to the Great Depression, which began with the stock market crash of 1929 and continued and worsened greatly over the next 5 to 6 years. The president at the time, Herbert Hoover, largely failed to respond to the worsening economic crisis, massive unemployment, and the other major factors that were contributing to really a catastrophe at the national level in the United States. When Roosevelt was elected after the end of President Hoover's term in office, President Roosevelt moved very quickly to respond to this crisis and to establish a number of reforms. And so I'm going to talk about the Social Security Act of 1935 as one of those reforms that dealt directly with the health and well-being of the American people. The Social Security Act is really important for a number of reasons. It is, in my mind, the key defining policy framework that establishes the structure on which we have built our modern social welfare state. What that means is it set up the basic programs and policies that we still build upon today, relating to programs for the older population, the elderly population, for children, for women, and just really across a number of sectors or populations in the United States. And the Social Security Act is also very, very important because it established for the first time a strong federal government responsibility to provide for the general social welfare of U.S. citizens. But prior to the Social Security Act, programs were much more fragmented and largely occurred at the state level. The Social Security Act established these programs as a federal priority and a federal responsibility. So I'll talk about a few of the key programs, recognizing that there are many others that we could address that were also put in place by the Social Security Act. But one key program was Aid to Dependent Children, ADC, which later became Aid to Families with Dependent Children, or AFDC. These programs are basically synonymous, but there was a title change in the mid-60s. ADC was a program basically prior to the New Deal that had been called Mother's Pensions. These were small forms of usually cash assistance that were provided to widowed women so that they could provide for the health of their children following the death of their spouse. So ADC, under the Social Security Act, established those mother's pensions as a federal program to aid children in low-income families, primarily those whose mothers had been widowed. Another important program I'm sure many of you have heard of is Social Security. So Social Security is one of the largest federal entitlement programs to this day, and it provides a minimum payment to retired individuals in the United States. So upon retiring from the workforce, individuals can apply for Social Security and receive a monthly cash assistance or a monthly retirement benefit. Social Security has been expanded over the years to include not just retired workers, but their spouses, their children, and a number of other vulnerable categories of people benefit from Social Security. As I mentioned, it's really one of the largest programs today, and it mainly benefits, although many other populations can qualify for Social Security, it mainly benefits retired individuals. Another important program under the Social Security Act was unemployment insurance. So recognizing the Depression as the key impetus behind the Social Security Act, the Social Security Act set in place a form of social insurance for unemployed individuals who could apply for and receive benefits for a limited amount of time if they became unemployed suddenly. So those are some key aspects or components of the Social Security Act. Another key component of the Social Security Act is Title V under the Children's Bureau, which expanded many of the programs I discussed previously that had previously been put in place during the Progressive era related to maternal and child health services. So Title V enabled states to expand services that had been previously provided for by the Shepherd-Towner Act. It provided services for crippled children's program and enabled states to locate and provide medical and other services for handicapped children in particular. And it established child welfare services that enabled the states to provide services to homeless, dependent, and neglected children. Before we talk about our next set of programs, I'd also like to mention a few other key points about the Social Security Act. The Social Security Act established the structure on which we've built many of our programs that continue today. It also made some key distinctions that are important to understand when thinking about U.S. policies and programs. The Social Security Act established universal programs and selected programs. So universal programs like Social Security are those programs in which individuals don't have to meet specific criteria. Specifically, usually in the United States context, that means specific income criteria in order to qualify. So a universal program like Social Security is given to all people who meet that requirement regardless of their income level. So low-income individuals benefit from Social Security when they retire, moderate income individuals benefit from Social Security when they retire, and indeed high-income individuals benefit from Social Security when they retire. In that sense, it is a universal program for retired people. In contrast, selected programs are those that are means tested. And what that usually means is that individuals who apply for those programs have to meet certain requirements in order to qualify. So again, in the U.S., that is often a income requirement. And so, for example, if we think about a program like AFDC or ADC, Aid to Dependent Children, those programs require that families be at or below the federal poverty line in order to qualify. Selected programs often have other requirements attached to them related to family structure, for example, being a single mother-headed household, and may also relate to the age and other criteria. But basically, the key distinction is that a universal program applies to all individuals, whereas a selected program or a means-tested program has certain criteria attached to it. Another important point I'd like to make is the difference between entitlement and non-entitlement programs. So entitlement programs are those programs in which one has a legal guarantee or right to receive the benefit. Again, Social Security is an example of an entitlement program. People who meet those criteria are legally entitled to receive Social Security. In contrast, other programs are not entitlement programs, which means that individuals may benefit from the services if funds are available, maybe depending on state requirements, etc., but they don't have a legal guarantee of receiving benefits or services. Although this doesn't neatly fit into the New Deal era, I also wanted to mention the National School Lunch Act of 1946. So this was a federal law that provides low-cost or free school lunches to qualified students through subsidies to schools. And I mention this primarily because this program, the National School Lunch Act, continues today and serves millions of low-income children to ensure that they have access to an adequate diet and lunches and breakfasts at school. Next, I'll talk about the Great Society programs. The Great Society programs include programs related to the War on Poverty and also the Civil Rights era. So essentially early to late 1960s. This was an era of great reform across a number of different domains, and President Lyndon B. Johnson was responsible for putting in place and promoting many of the programs that I'll be talking about under the Great Society. First, the Food Stamp Act of 1964. This is a critical program to understand because, again, it continues to be a primary source of assistance to low-income families today through the Supplemental Nutrition Assistance Program, or SNAP. Many of you have probably heard of SNAP. It offers nutritional assistance to low-income individuals and families. SNAP is a means-tested entitlement program, which means to qualify, families have to meet certain income requirements, but if you meet those income requirements, you are entitled legally to receive SNAP. SNAP is, much to many people's surprise, one of the largest programs in the domestic hunger safety net. In fact, as of 2013, more than 15% of the entire U.S. population received food assistance through the SNAP program. and nearly half of those households are households with children. So SNAP continues to be one of the key programs in our social safety net to meet the needs of low-income families and children in particular. But it began in the 1960s as a part of the Great Society programs. Next, I'd like to talk about the Head Start program. The Head Start program is another program that serves low-income children and families. Head Start was originally conceived as a summer school program to prepare low-income children for elementary school. So previous to the Head Start program, there were really no preschool programs that helped prepare low-income children for elementary school. So this was a way to help catch up those children and get them ready to go into elementary school and be successful. Head Start has been an enormously popular program and has been expanded greatly since the 1960s. Early Head Start was established in 1994 to serve children from birth to age 3, so prior to preschool. And today, Head Start serves over 1 million children and their families each year. Importantly, Medicare and Medicaid were also established during the Great Society era as a part of the Social Security expansion of 1965. So prior to 1965, there was no health insurance mechanism under the Social Security Act. Medicare and Medicaid were established to address that gap in the Social Security Act. I'm aware that you're learning more about Medicaid and Medicare through some other modules in this MOOC, but I just wanted to mention that these programs were established during the Great Society era and are really important programs serving the health needs of millions and millions of low-income families through Medicaid and millions of elderly or aging individuals, retirement age individuals, through Medicare. Additionally, during this time period, we saw many reforms of the civil rights era. I'm only briefly touching on these, but just want to highlight that in conjunction with the War on Poverty and the Head Start program and many other reforms that were made in the mid-60s was an intense movement forward on the civil rights front. The Civil Rights Act of 1964 forbade job discrimination and segregation of public accommodations, including housing discrimination. The Voting Rights Act of 1965 assured that minorities had the right to vote, so it outlawed things like poll taxes and literacy tests and other mechanisms that had been put in place essentially to eliminate the possibility of low-income people and minorities, especially in the South, of accessing their right to vote. Those types of procedures were outlawed through the Voting Rights Act of 1965. And it also, the civil rights reforms also established the Immigration and Nationality Services Act of 1965, which abolished the national origin quotas in immigration law. Next, let's talk about the child welfare system, policies and programs after the Civil Rights era and the Great Society and War on Poverty programs of the mid-60s and beyond. So the Child Abuse Prevention and Treatment Act was passed by Congress in 1974. So this is a very important law that establishes a number of services, programs, and legal requirements related to abused and neglected children in the United States. So CAPTA established the National Center on Child Abuse and Neglect. CAPTA required states to strengthen child maltreatment programs in the area of state definitions and reporting laws. Another way to think about that is CAPTA set up the framework for states to collect data on child abuse and neglect, how many children are affected, what kinds of programs and interventions are provided to those children and families, etc. CAPTA established those guidelines at the federal level. It also established a federal minimum definition of child abuse. So prior to 1974, with the passage of CAPTA, there was no established, acknowledged federal definition of what child abuse and neglect was defined as in the United States. So CAPTA is an enormously important program for understanding our current system to protect abused and neglected children in the United States. We often also refer to that as Child Protective Services, or CPS. Following CAPTA is the Adoption, Assistance, and Child Welfare Act of 1980. This reinforced the importance of services within the home. In other words, to reduce the number of children moving into foster care settings. This act established family unification as a priority that continues to this day within the child welfare system. This act also established the development of case planning and 6-month reviews for children in the child welfare system. So another way to think about this act is that it established some basic kind of procedures and processes that agencies at the state level are required to put in place to protect children who are involved in the child welfare system and to ensure that they are moving through the system in a way that is beneficial to them in the long run. So following the Adoption Assistance and Child Welfare Act of 1980 is we kind of jump forward here about a decade and a half to the Family Medical Leave Act. The FMLA is a widely known program in the United States that affects millions of families. It provides up to 12 weeks of job-protected unpaid leave during a 12-month period for the birth and care of a child, family member, or an individual's own health condition. In other words, it provides families, women and men, with the option to take unpaid leave from their job to attend to their family care responsibilities. And employers are required to hold their job, essentially, for that time period and allow them to return to work following the 12 weeks of protected job leave. Although FMLA is gender neutral in language, in other words, men and women can take FMLA leave to balance their work and family life, data suggests that as of 2010, women make up the majority, about 80% of the individuals who take leave under the FMLA. Next, in the mid-1990s, was the welfare reform era. So previously I mentioned ADC, Aid to Dependent Children, which was one of the key reforms under the Social Security Act of 1935, which later became AFDC in the 60s, these were the programs, mother's pensions, cash assistance to low-income, single female-headed households. The Personal Responsibility and Work Opportunity Budget Reconciliation Act of 1996, also called Welfare Reform, eliminated the AFDC program. Previously to welfare reform, AFDC was an entitlement program. So women who were low income, who had children at home, and met the income requirements and family status requirements were legally entitled to receive AFDC. Welfare reform ended that legal entitlement and established another program called TANF, or Temporary Assistance to Needy Families. Welfare reform also put in place a number of other reforms. It required women to work in order to receive welfare. So in other words, women would have to engage in activities such as looking for a job or educational activities, attending school, in order to receive welfare benefits or TANF benefits. Welfare reform also changed the funding structure for this program and established block grants administered at the state level rather than primarily administered at the federal level. So this was really a very significant and one of the most major reforms of the Social Security Act in ending the AFDC program and in ending the entitlement of low-income women in single mother-headed households to receive cash assistance to care for their children. A few years after welfare reform was Title 21 of the Social Security Act, which established the State Child Health Insurance Program, or SCHIP. SCHIP acknowledged that there were some very significant gaps in meeting the health care needs of low-income children. Very poor children or families that were receiving, prior to welfare reform, were receiving AFDC could qualify for Medicaid. But many working-class families or families that were close to but not eligible for welfare for a number of different reasons didn't have access to adequate health care for their children. So SCHIP was passed to address the large number of uninsured children in low-income working families who couldn't get Medicaid because their family income exceeded the eligibility criteria. So SCHIP is a very popular program, usually not too controversial, and although in the recent year we faced a reauthorization crisis in which Congress kind of held up reauthorization of SCHIP, and many advocates were crying out for reauthorization given the just very large number of families that benefit from the SCHIP program and ensuring that their children receive adequate health care through SCHIP. Finally, I'd like to talk about another really significant policy in the post-welfare reform era, and that is the home visitation program, which is established or funded through federal funding from the Maternal, Infant, and Early Childhood Home Visiting Program, or MCHSW5302017-V004000 of 2008. Home visiting programs are enormously important in serving the needs of low-income, primarily low-income, women and children in the United States. These programs serve, for the most part, at-risk pregnant women and families and provide them with resources and skills to help them raise children who are healthy and ready to learn. The MCHSW5302017-V funds numerous evidence-based programs that many people have heard of, including the Nurse Family Partnership Program. So MCHSW5302017-V has been one program that has helped to fill some of the gaps in our response to maternal and infant care. It's also notable that these programs have also been shown to prevent child abuse and neglect. So earlier I talked about the CAPTA law and the requirements at the state level for reporting child abuse and neglect. What CAPTA didn't establish was a strong system for child abuse prevention. And MCHSW5302017-V is one program that helps to address that gap to some degree by helping at-risk pregnant women during the transition to parenthood. In conclusion, I'd like to thank you all for watching today. I hope you learned some important information about social welfare policies and services for children and families in the United States.